of children, and technically it's 1 in 200, but in my experience, it's way more than 1 in 200. And I see this more and more frequently over the last 10 years. The immune system gets confused, and those antibodies that have been created against that infection, let's say strep, cross over the blood-brain barrier and attack the basal ganglia of the brain. That results in a variety of symptoms that primarily look like acute anxiety in a great form, like severe anxiety that seems to come out of nowhere. So this comes on within days to weeks and as a complete change to the child's baseline. So it might look like acute anxiety or separation anxiety or OCD or extremely picky eating or food aversions, which nearly looks like an eating disorder, but eating disorders don't come out of the blue. Eating disorders don't happen within a few days, 2 weeks. So that's always a symptom, a clue. The other kinds of symptoms that one might see is a change in behavior, so maybe more clingy, maybe more oppositional, a change in academic performance. So somebody that might have learned how to read or do the math facts suddenly can't, a change in handwriting, a change in balance and knowing where they are in space, starting to have urinary accidents either during the day or at night, having lots of physical concerns like headaches or tummy aches, a heightened sense of sensory sensitivities, the light's too bright, the noise is too loud, kids are overwhelmed. And you don't have to have all of these symptoms. You can just, you need to have either the picky change in eating and an acute anxiety, OCD, and then just 2 of the symptoms that I mentioned. So when that happens, it's a sense of the brain is inflamed because the immune system has turned on the body. That's the autoimmune word within the definition. So pediatric acute-onset neuropsychiatric syndrome is what looks like anxiety that comes on quickly, but it's as a result of neuroinflammation in the brain in an autoimmune aspect. And so treating that with an anxiety medication like an SSRI isn't going to make any difference at all.
As always, consult your physician before trying any of our products. For more information, visit NeuroNeeds.com. We would appreciate it if you would like, share, and subscribe. Thanks for being part of our journey.